we've seen as a result of this COVID pandemic and the investment the government's put in, we're putting an extra £45.6 billion into healthcare. That's an extraordinary amount of money. And indeed, the Institute for Fiscal Studies says that by 2024, healthcare will account for 44% of day-to-day government spending. That's just 56% left for everything else. I mean, that's an extraordinary statistic. And we've got to really make sure that we get value for money out of that money that is going in. We need to do much better. And when I say we, I'm not talking about individuals working for our NHS. I'm not talking about doctors, nurses, allied health professionals, people on the ground. I'm talking about the system as a whole. And we need to do much better. And I just wanted to kind of suggest a few things that I think may help. The first is ensuring that clinicians and those working in our NHS operate at the top or practice at the top of their licences. And we make better use of other healthcare professionals, such as nurse practitioners. And we make use of things that have been around for a long period of time, like nurse-led prescribing. We need to be investing in systems and technologies that allow us to have more day cases rather than more expensive inpatient services. This all seems like common sense, but it's the same debate that's been going on for about 20 years in the NHS, where it talks about increasing productivity. And these are some of the arguments I've had, I've been making for a number of years, not just in this house, but outside this house as well. And I think it's absolutely right that we make more effective use of pharmacy and pharmacists. I speak to pharmacists in my constituency, and they want to do more, Mr. Deputy Speaker. They did so much during the pandemic. They did so much in terms of vaccinations. They can do so much more. So all of us wants an NHS, a National Health Service, that's working as it should be. All of us want systems in place that are working as they should be. And all of us want to see a fully funded, an appropriately funded and appropriately staffed National Health Service.